and I am the Workforce Development Specialist at the Global Health Supply Chain Procurement Supply Management Project. And I have with me today Bridget McHenry, and Bridget is the USAID Senior Organizational Development Advisor for Commodity Security and Logistics at USAID with USAID's Global Health Bureau in the Office of Population and Reproductive Health. And together we will be conducting this webinar with you. We are recording the webinar and we will be circulating the webinar link for those unable to make the call today. So we have a couple of things that we'd like to do as part of the outcomes for today. One of those is that we would like to help you to really understand the need to systematically improve human resources capacity and systems, and to improve HR performance in supply chain teams. Our background is particularly in health supply chains, so supply chains that are responsible for moving health commodities from inside the country down to the service delivery points for the benefit of beneficiaries and patients. But the things we're talking about today will be relevant in a range of supply chain contexts. We also want to have as a learning outcome to use the people that deliver theory of change for supply chain management to understand the 4 pathways that are used to optimize workforce performance in supply chain management and the actions required to strengthen these particular pathways. What we're going to do is 3 things. One is I'm going to give you an introduction. I'm going to hand over to Bridget, who's going to be introducing and explaining the theory of change. And then we wish to share with you a case study from Rwanda. As we go, if you would like to put your questions in the chat, we have a couple of particular points during the presentation where we will be looking at those questions and seeking to answer questions for you. Just before we proceed, I just want to make sure that I've clicked the recording button, which I have. And just to make sure, Bridget, can you just check and see that you can see my screen okay? I think we're all in order. There was a small delay in the thing coming up, so thank you for that. So the first question is, why do we need to focus on human resources in supply chain? With 1/3 of the world's population without medicine, with a lack of human resources in many sections of healthcare, why should we focus on human resources in supply chain management? And for us, there's a couple of big reasons for that. One of those, before I move on to the next slide, one of those is that supply chains are the key enabler for all health programs. You've heard no product, no program. Supply chains for health commodities are particularly important for the delivery of health commodities. And basically, if you don't have the right people with the right skills running those supply chains, supported by appropriate human resources policy and the people to really monitor those people, to ensure they are motivated, then you're not going to have a well-functioning supply chain. A number of you will be familiar with People That Deliver. This is an organization that's promoting sustainable workforce excellence in health supply chain management. And from their particular research, they note the following on the screen before you as all causing a reduction in supply chain performance because of workforce-related issues. This can be job description issues, lack of planning and financing, lack of credentialing, or a lack of professional development, for example. A couple of other things that are of interest is some of you may have seen this slide before. It's from data from the vaccine community, Gavi particularly. And they've noted that there is a 24-fold increase in the value of vaccines that will be coming over the next few years. This is put out to 2020. And that will also involve a 5-fold increase in workload And so the current stressed supply chains will be becoming even more stressed. You could do similar analyses in non-communicable diseases with the increased number of products required by governments to look after these diseases. HIV/AIDS, where there's a range of changing environment for different commodities to keep in line with treatment regimes. To other places where there is increased stresses on the supply chain. And there are others. One of the most significant is universal healthcare. As countries increase their health packages available to beneficiaries and patients, the number of products will be increasing in the supply chain. At this point, I'm going to just hand over to Bridget, who's going to introduce people that deliver and also go through the presentation at this time. Bridget, may I just check that I've given you control? I think I've given you control. Bridget, can you confirm that that's working for you? So. Bridget, just confirm your audio for me, please.
Okay, can you hear me now?
Yep, I can hear you clearly.
Great, okay.
I'll just see that you have screen control. Do you mind just checking that you can progress the slides, please?
All right. It does not seem
so let me help you
that I can progress. Okay. All right. Good morning, everyone from Washington, D.C., or good afternoon or good evening, depending on where you are in the world. Andrew, if you want to progress the slide. I want to introduce, for those of you who are not familiar, the People That Deliver initiative, which is the body under which this theory of change was developed, and the initiative that convened this piece of work. People That Deliver is a global partnership. It's organizations that focus specifically on the professionalization of supply chain personnel, and doing so by advocating for a systematic approach to human resources for supply chain management, both at the global and the local level, and doing so ultimately with a vision of a world where health supply chain workforces are empowered and equipped to optimize health outcomes by improving access to health commodities. Next slide, please. So the theory of change concept, let's talk a little bit about what that is. Next slide. So the theory of change process is essentially, it's a mapping to describe how and why a specific change is expected to occur, and it explains the pathways through which results can be achieved, and helps you to understand what the chain of events is that exists between program interventions and the goals or the desired outcomes you're trying to ultimately get to. Next slide, please. So theory of change has two parts. It has this mapping, this outcomes diagram. And in fact, the theory of change that we developed, as we'll get into, it actually has two diagrams, a more higher level summary diagram and an in-depth mapping, and then also narrative that describes it in further depth. Next slide, please. I'm going to skip questions at this point. We'll come to them in the next section. So what are the benefits of a theory of change? If we go to the next slide, there's two things here. We want to understand the change that we're trying to create and have a clear hypothesis about how that change is going to occur, which is critical for being able to program interventions in an effective and logical way. And more specifically, we want to be able to describe what the impact of interventions and investments are going to be. In this case, what is the impact of investing in human resources for supply chain management? We had this general understanding that it's important to have a highly functional supply chain workforce in order to have an effective supply chain operation, but how do we map out how specific interventions in different areas of that workforce actually contribute to that ultimate outcome or impact? Next slide, please. So again, just for the context, and Andrew hit on this a little bit already, we've got hundreds of millions of dollars in commodities flowing through these health supply chains, but are still operating in a context where often the critical function of supply chain, the importance of how supply chain is critical to your health outcomes is rarely acknowledged. And often the workforces in these supply chains don't have the right technical and managerial competencies in order to perform optimally. Or perhaps they don't have the empowerment to actually affect supply chain decisions and policies. And ultimately, we recognize that having insufficient numbers of competent staff can cause this breakdown in the supply chain system, and resulting in poor system performance. Next slide. So our theory of change has 6 potential uses. The first one is to understand and to convey the complexity of the supply chain HR system. And this is really valuable for folks who were advocating to engage in investing in this, who need to better understand what their role is. It helps to show the whole picture and how actually this is a complex system. It's not an easy thing with a single intervention that's going to resolve it. And to that end, it can explain the causal pathways and the change processes for optimizing workforce performance. And that can be used as an explanation both for the internal and the external partners. And as an advocacy tool to advocate for the importance of investing in the HR aspect of supply chain. You could also use this mapping, particularly the more in-depth, broader framework, as a design tool to help you design which interventions you need to focus on, and doing so with a solid rationale that helps you maximize impact. You can use it to plan and measure the effect of these interventions, and finally to assess the effectiveness of your HR management systems. Next slide. So, are there any questions at this point? If not, we'll move into talking about the specific details of the framework.
So we'll just take a moment. So those on the call, the way we're going to do questions is in a written form. So if you want to take the time in the chat, and I'm just showing you on the screen where that is, to type in a question. If you have a point of clarification or of a question, you can type it in there. And while you're typing away, we'll allow Bridget to continue. And then we'll come back to here to see what particular comments you may have. So Bridget, handing back to you.
Great, thank you. Let's go to the next slide, please. So let's talk about the components of the framework. Next slide. Okay, so this is the image we see on the screen here. This is the overview. This is the sort of more simplified version of the theory of change framework. It's more accessible, easier to use for that higher level advocacy functions, and we're going to use it to start out with to start describe the different components. Andrew, if you'll click. So up at the top here, we have our ultimate goal. And if you'll go to the next slide, Andrew. There's a lot of clicking, a lot of animation here. So click once. So the ultimate goal is what the future looks like. Next one. So we're looking for commodities to be available at the service delivery points to meet needs in the most cost-effective way possible. Click. So that health outcomes are improved. And this means essentially we're trying to enable health outcomes through continual commodity availability. That's the purpose of everything we're trying to achieve here. Go to the next slide, please. So then if you click, we've got our long-term outcome. Next slide. Which is what must be true in order to reach our ultimate goal, that workforce performance is optimized. That we know we have to have a workforce that is in place and performing optimally in order for our commodities to be available in the most cost-effective way possible. Yep. And then to do that, we've got these 4 pathways. And this is really where the content of the theory of change lies. Go ahead to the next slide, please. So the 4 pathways are what need to happen for the long-term outcome to occur. And we've got, in our theory of change, there are staffing, skills, working conditions, and motivation are these 4 pathways. And to achieve, in each of these pathways, to achieve the long-term outcome, there are 4 top-level outcome areas that must be in place.
Bridget, let me just interrupt you for a moment, just to, ladies and gentlemen, can you please mute your microphones? Thank you. I'm just going to do a little function here.
And if you want to try and see if you can succeed in handing it back over to me so I can do the clicking for you.
So according to me, it says that you have control. So that's the bit that I'm not sure about.
All right.
So just try and see if you can progress from there, Bridget.
Okay. No, it doesn't seem to be that when I click anything happens. All right. Well, we'll proceed like this. Okay, you can go ahead and proceed through.
I think we're up to here.
Yeah, so here are our 4 top-level outcomes: that all critical supply chain positions and or competencies are filled. In terms of skills, that staff apply their skills as appropriate at every level of the supply chain. And note that's a distinction between having skills. It's one thing to possess a set of skills. It's another thing to be actually applying them on the job. In terms of working conditions, it's that the working conditions actually support performance. And in terms of motivation, that workers are motivated to do their jobs. This map now is the broader outcome map, and we're going to use this to really hone in on the more specific details and what the pathways actually look like. Next slide. Go ahead. So go ahead and click. We're going to actually look at the staffing pathway. And these boxes that you see highlighted that make up the preconditions component of the staffing pathway. Go ahead, Andrew. Okay, so the preconditions are what information is included in each pathway. Each of these pathways contains a set of outcomes, and they're listed in a specific sequence. So, for example, in the staffing pathway, we're going for the outcome of the top-level outcome of all critical supply chain positions and or competencies are filled. And as each outcome in the chain is realized, the conditions that must exist in order to achieve the next outcome are being built. Go ahead. And go ahead. You can just click the next 2. So that's why we refer to these outcomes within the chain as preconditions. So it's hard to see on this slide. It's a little unclear, but at the bottom you see on the far left the ability to develop the right job descriptions and an effective recruitment system is in place. Those are preconditions that are necessary for the ability to recruit candidates, which in and of itself is necessary for all critical positions and/or competencies being filled. So that's why we talk about it as a pathway. You actually move up the pathway from these preconditions towards reaching the outcomes you're trying to achieve. Go ahead to the next slide, please. And so one last piece of information about the structure of this whole framework is it is color-coded. So the dark blue boxes at the top, those are the key components of each of the pathways, and below that there are these light blue and brown boxes. Those are those higher preconditions leading to the key components, and our orange boxes are non-policy, lower level preconditions, sort of the first steps, if you will. And the green boxes are actually their specific policy preconditions. We pulled those out because policy interventions can be different than other kinds of workforce interventions, so we wanted to highlight them separately. Next slide, please. And lastly, there is at the bottom, and sort of if you'll see with the little box that goes all the way around back up to our health outcomes being improved, this foundational principle, which is critical to all of this coming together, and that's that the importance of the supply chain is acknowledged throughout the health system and positioned accordingly. This is sort of the foundational principle because it's essentially make or break. It's really hard to have any really resounding success in pushing forward supply chain improvement interventions when ultimately the health system isn't valuing the supply chain and it's not positioned to succeed. Next slide, please. In terms of content, in the staffing pathway, we've got 3 key outcomes that are critical to achieve our long-term outcome. That the ability to recruit quality candidates, that there's an adequate pool of workers to draw from, and that there's sufficient budget to hire the necessary numbers and levels of staff. Next one. In terms of the skills pathway, we are looking to see that staff have adequate technical and managerial competencies. And a note about that is that this is where thinking about what if we're talking about a supply chain with more private sector engagement or outsourcing, those skills don't have to be for actually running a supply chain. They could be for overseeing contracts and outsourcing and management and engaging with the private sector, right? It's having the right skills for the specific context. We specifically called out the need for staff to have leadership skills, and that staff across and throughout the system understand their roles and their responsibilities. Next one, please. Now, if we talk about the working conditions pathway, this one sometimes gets neglected, but is pretty critical for actually that piece of translating, having skills to be able to use them on the job. Workplaces conditions are really critical for how on-the-job behavior is actually expressed. And there's a requirement of a favorable social and emotional environment, a physical environment that is safe, clean, and conducive to performance, and up-to-date, relevant tools and equipment available. I mean, without any of these things, even the most properly trained, skilled, experienced staff are not going to be able to perform their jobs correctly. Next one. And again, thinking about performance, let's talk about motivation. The motivation pathway has, again, 3 key components, 3 key outcomes areas. One is that good performance is supported. And implicit in that is that poor performance is addressed and corrected. That workers have a sense of ownership of their role, and that ultimately supply chain workers understand and care about their role in the health system. They have that connection to mission. So those are the key areas of each of the 4 pathways. Next slide, please. But it's important to keep in mind that the pathways have to be approached in parallel to achieve successful change. And that's part of the reason why we have this great, big, complex map to look at is because it's to help us understand that each of these single pathways relies on the other one also to be regressing in order for there to be ultimate success, right? So as mentioned in the example here, skills alone are insufficient if your working conditions are not optimal or you don't have enough staff to begin with. So next slide, please. So questions. I see we've got some questions that have come through in the chat box. So I'll go ahead and answer those at this point. The first one I see is, please explain the differences between a theory of change and the results framework. It seems complex. And I think, yes, you absolutely, you answered the question yourself. It's the complexity. The reason why you use a theory of change framework is because a results framework can be overly simplified. And if you really want to map out what the complexities of the situation are and understand how they all interrelate with one another, it helps to have this broader mapping to see how the different pieces come together and how you have to you sort of have a hydraulics of how you work on the different areas in parallel or simultaneously with one another. So the benefit of the theory of change, what makes it challenging sometimes to initially wrap your head around, but what its ultimate benefit and purpose is, it is describing that complexity in greater detail than you could get with a results framework. So the next question is, what makes specific HR and SCM other than HR strategies in any organizations? So I think the question is related to how is this actually specific to supply chain management and not just an HR theory of change. And if you go into the boxes of some of the pathways, you'll see there are pieces that really are specific to some of the challenges we're facing in supply chain management. And one that's really specific is, and we see a lot, is relates to being able to create job descriptions that have the right kind of professional cadre associated with it and the ability to make that work within the public sector framework, where for supply chain management, that's been a consistent and ongoing challenge. Now, frankly, this framework could be easily adapted to other contexts because it does draw on a broader understanding of human resource systems and complexities and problems. So it would not be hard to extrapolate and apply this in a different context. It's mostly that the way it was developed starting with the real and actual challenges that we are facing and we see being faced in the supply chain context where we work and figuring out how to put them together. So it was built for supply chain. It could be applied elsewhere. The role of gender equity and where does that lie in this pathway? That's a great question. A huge piece of that is in the working conditions pathway, they're specifically called out equal opportunity policies, but also that talks about safe and welcoming socio and emotional environment, and so there's a number of components if you sort of dig into that working conditions pathway that really are meant to address how gender comes into play in the supply chain workforce. And then the last one I see is that one of the challenges in public sector staffing pathway is that the pool is actually increasing, but the recruitment of these competencies is compromised. I'd be interested to maybe talk a little bit more offline about what that means, but yeah, I think I think you're right. I think that it's not enough to have a workforce that is available to work, you also need a functioning system, and in this case, a recruitment system that is designed to be able to not only identify and engage candidates, but identify the best and most appropriate candidates. And I think that can often be a challenge, particularly, as you mentioned, in the public sector, where there's policies and regulations that govern the entire public sector, and it's hard to then accommodate to a specific area to meet the very unique technical needs of supply chain. And one more question came in. It's very small print, so I'm going to do my best to read it. Do you think engaging into this analysis within an organization should be done by a supply chain management team, or is it better to have more external point of view and this reflection to be led by a team engaged in continuous improvement or change management team? Who is better positioned to develop this? Corley, I think that's also a great question, and my initial response is that that's going to really depend on context. I think it depends on a couple of things. I think that there are places in the world where having the kind of authority of gravitas of external team coming in carries a lot of weight, and that makes people pay attention and they want to engage. I think there are other places where having outsiders come in is less welcome and a little more resented when there's feeling that there's enough expertise in-house. I think it also depends on what's the strength of your supply chain management team and how well respected are they already within the system. Is that a team that's being listened to and they've got that sort of that attention of the higher up decision makers? If so, then there's no reason why they couldn't begin to push this forward on their own. But if they feel that they need some extra expertise to come in, then certainly be great to engage with people that deliver and see how we could potentially support that. Okay, we're getting a lot of questions, and we still have some more slides to go through the theory of change. So what I'm going to do is I'm going to bounce back to the slides because I am conscious of time. I'm going to go through this next session, and then if these questions still aren't answered, we'll come back and talk about them. So we've just gone through the theory of change and the framework and what's included in the mapping. We still have this other component of it, which is the narrative. And so let's talk a little bit about what that contains. One of the key things, and this is what I think actually is a really important piece of the narrative personally, are these critical assumptions. These are 9 assumptions that underlie the entire theory of change, and that what our rationale is, what our understanding of the context is that we're basing it on. And that's that, one, the assumption that optimizing supply chain management work performance will lead to improved commodity availability and health outcomes. Essentially what that's saying is that what the workers do is what drives how the supply chain performs, which I think is a safe assumption, and we're confident with that. As we mentioned, it acknowledges that the importance of the supply chain enhances the efforts to optimize workforce performance, and that goes back to that foundational principle we talked about that was at the bottom of the Great Big Map. We acknowledge that adopting a cross-cutting approach will lead to greater results, and so looking across these pathways, not just trying to do one of them. We also thought it was really important to acknowledge that the cadres that perform supply chain management, that they vary between different country contexts. There are regulations, there are policies, there are civil society staffing structures. So you may have a logistician doing a job in one country, and it may be you may have a pharmacist doing it in another country, etc. And that this acknowledges all of those contexts and is applicable in all of those contexts. It's not prescriptive one way or the other. we also acknowledge here the assumption that the public sector supply chain can leverage private sector best practices to create change. And similarly, that health supply chains are often neither entirely embedded in the public sector nor in the private sector. So that with both of those, we're really calling out, thinking about and understanding the role of the private sector in all of this, and not being, having blinders on and only focusing in on government and public sector, but being broader in your understanding of the supply chain and who the players of it are and can be. There's a really important assumption that well-functioning human resource management systems with effective policies and well-defined processes enable optimized work performance. And that's pretty well documented and evidence-based, so it's a safe assumption to make. We also have this assumption that strengthening the role of supply chain leadership and supervisors will lead to optimized work performance. And if you go in and read the narrative, you can read a little bit more about why we specifically called out thinking about leadership and supervisors. And lastly, that cultivating motivation and skills ultimately improves work performance. It's one of those assumptions that if that has to be true for all of this to come together, but we are confident in each of these 9 assumptions. Next. Another really useful piece of the theory of change, and that you can find in the narrative document, is this indicators catalog. So for each of those boxes on the very complex map, we've gone through and we've brainstormed potential indicators that you could use to measure impact at each level. So if you're going to have a design and intervention at any one of those levels, here are some indicators that you could consider using. And you could have this as the basis for a systems-focused performance assessment if you wanted to just go in and see at these different levels what could we measure to see how well we're performing, or you could use it as M&E if you are designing interventions along these pathways. Next one, please. And this comes back to the 6 potential uses for this theory of change. And I think, Andrew, is the next one the question? Yeah, so let's go ahead. We can leave this slide up, the slide with the 6 potential uses. We'll leave that on, and then I'll go back into the chat box and see if I can answer some of these questions. Okay.
Just while Bridget's finding those questions, just an open invitation. If you do have a question or a comment, love to hear from you in the chat. So please type in your question there, and Bridget or I will get to those as we proceed. Back to you, Bridget.
Yep. So one of the questions is, how can we empower government to motivate their employees? Because we can't just motivate one sector and disregard the other sectors. How can we ensure the proposed solutions, good working conditions, and motivation can be sustained in the long run, and at the same time reducing costs? That is an excellent question. It's sort of the million-dollar question, if you will, and one that folks are still working on trying to figure out what is that balance. I think an important thing to keep in mind is that often when we talk about motivation, particularly when we talk about motivating staff, people hear that and they hear a little cha-ching noise, right? They hear motivation and they think, oh, that's money. You motivate people by giving them money. And so there are actually studies that show that there are more effective ways to motivate folks than just giving them more money. So certainly that is one way. And I don't know many people who would not like to have more money. That I'm not saying that there isn't an element of salary adjustment that's important, but there are other things as well. There are other benefits. There are training opportunities for advancement. In some cases, motivation has to do with, where you can get positioned in the government sector, where you get sent to live in the country and what the opportunities are there. There can be things like spot awards, one-time awards for performance, and that can be done in a way that is either a recognition or with some sort of remuneration or benefit. It does get trickier in the government system, and I think that's why there's a push in many countries to try and pull the supply chain out of the government system to a more autonomous entity that can operate more along the lines of the private sector, and that's one of the reasons why. But ultimately, it's a balance, things like using donor funds for performance-based incentives can be really valuable, but also carry the risk of sustainability, because how do you continue to have that when you can't necessarily count on those external funds always being available, and they're not changing the base salary. So ultimately, there's the risk of just reverting back to base salary, which can be very demotivating. So it's a complex question with not a single driving clear answer to it. Let's see.
And Bridget, as you're finding that next question, I just wanted to add that in the webinar we did 2 months ago, we highlighted the point that for staff motivation, a number of studies are simply showing that recognition is a key motivator. So in other words, acknowledging people for the work they've done and giving that verbal recognition, whether it's a smile, a handshake, or some type of acknowledgement, goes a long way in workplaces. We're in environments where a wage is an appropriate wage for the cultural context. Recognition and responsibility are the next big things in terms of staff motivation. And as Bridget mentioned, not always money. Back to you, Bridget.
Yeah, so the next question is, in the context of low and lower middle income countries where even the HR system within private sector supply chain is least organized and may not be developed at all, do you think the PtD HR for SCM could be a driver for change? We often assume incorrectly that supply chain management in the private sector are better organized in low and middle income countries. I think that's a great point. I do think you're right. I think there is this kind of prevailing mentality that if it's private sector, it must be optimized and more effective. And I think that you will see that there are a lot of companies that are not run at the sort of optimal way, and perhaps not better. And the benefit often, particularly in places with lower economies, is that sometimes you have the benefit in the government sector of transparency that you don't have in the private sector. And so even though the government sector has its inefficiencies, at least it may have the transparency that you kind of want and need. So again, I think that point of challenging the assumption that private sector is ultimately better is important. And I think, again, it comes to context and weighing what makes the most sense and what are the best solutions that are context driven. I do think that this tool, this mapping, can be applied in a private sector context, in sort of a private sector supply chain operation, just as much as it can be applied in a public sector. So it could be a tool in either context, depending on what makes the most sense for that country. The next one is, can you please explain this pathway in relation to the PtD building blocks of HR and SCM? Okay, that's a great question. So, Andrew, we don't have the building blocks as a slide, do we?
Not today.
Okay, so for those of you who are familiar with this, the People That Deliver has another framework to understand HR for supply chain management, and the building blocks in that are slightly different than the way we have it framed here. We've got these 4 pathways: staffing, skills, working conditions and motivation, and those are different in terms of terminology to the building blocks, but Elias, we actually did map as we were building this. We were thinking of those building blocks as well, and we mapped this back against them just to make sure that we were incorporating everything, that we weren't missing anything from the building blocks in this model, but that this model really applied to how, describing how those interventions lead to the outcomes. So I hope that sort of answers that question. So another question is, where is the organizational support in terms of effective leadership, supportive supervision from this pathway? So I think, Boniface, I think if you actually, and I believe that Andrew will be sending everyone who participates in this the link to the documents, including the narrative and the mapping, but you'll be able to see, if you look in detail at those boxes, all of those pieces are in the pathways, that all of those that you mentioned are included. Okay, from my experience with STEP leadership classes in the public sector, if the Ministry of Health leads from the top, everything flows. However, the participants have to return to the workplace and actually teach their supervisors what they learned in order to get buy-in. It is an uphill battle to drive change. Yeah, that's absolutely true. And part of how we envision this tool being used is to help the higher level leadership within the supply chain organization really understand the complexity of the HR system and how all these pieces come together, and also why leadership training is so important, and why we've been focusing on, as a separate initiative, leadership training that does absolutely focus on that upper high level. I'm noticing a switch in slides here, and I'm also noticing the time. So I'm going to turn back over to Andrew, who does have a case study from Rwanda to talk through in the time we have left. And if there's time remaining after that, we can get back to more questions.
Thank you so much, Bridget, and thank you everyone for your very thoughtful questions, and I encourage you to keep going with those. We at least will try and stick around for as long as we can for those who still have outstanding questions. I've set some time available for that, even if Bridget's unavailable. So what I'd like to do is just over the next few minutes is share with you how we've applied this theory of change in a case study context in Rwanda. I'd like to acknowledge our GHSC-PSM consultant, Erin Meyer, who has done all the work in relation to this in conjunction with the Ministry of Health in Rwanda, our GHSC-PSM team in Rwanda, with some external support from People That Deliver, USAID, and myself in GHSC-PSM headquarters. So basically, the objective of the mission to apply this in Rwanda was threefold. One was to use the theory of change as a structure for the ministry to prioritize interventions in human resources for supply chain management. So in other words, to use a theory of change as a structured approach to help the government understand where their strengths and weaknesses were, and so the weaknesses would then point to particular interventions, and the theory of change was suggesting interventions that could then be prioritized and budgeted for to improve that aspect of the theory of change for pathways. The other was they were very interested to have a closer look at the M&E indicators that sat behind a number of these pathway components. And as Bridget mentioned, the supporting documents to the theory of change has a compendium of a range of indicators. And in this context, the ministry wanted to see which indicators would suit them to measure to be able to monitor ongoing improvements in their system. And then the last objective was to provide a foundation for developing an overall HR for supply chain management strategy. In other words, realizing that human resources was a significant component of their supply chain, what were the range of activities they needed to do over time to improve that. The broader objective for us, or the broader objective for the ministry rather, was to acquire a detailed understanding of the change pathway that connects interventions and investments in HR to health supply chain performance improvement. And so again, using the theory of change as a way of systematically thinking about this in the country context. So how do we do it? So we have, as we understand that there is this causal pathway and change process for optimizing work performance. As with any improvement of a system, you need to assess the effectiveness of that system. And this theory of change was used to take a deeper dive to assess the effectiveness of the 4 pathways that needed to be in place for the optimizing of the supply chain system in Rwanda. Then, with that thinking, to design interventions that were based on a solid rationale to maximize impact, rather than just, I think we should do this. But in addition to that, we need to be able to measure the effectiveness of the interventions to improve the management systems using indicators. The optimal way to do systems change is after we've made an intervention, we want to measure to see that that particular intervention has impact. So this was the approach. There were 3 particular steps that were conducted. As one colleague in the call today has noted, it appears on first glance that the theory of change is complex. But actually it's not. I would say that it is detailed. What that means is you need to take the time to have a look, or if you're introducing this to a ministry, as we were in this case, you need to take the time to help them to understand the detail and to help them to digest the information and work out how to apply it. We did this in 3 steps. One was to identify the preconditions that are already developed and priority areas ready to be targeted. The way that we did this was to place aspects of the theory of change into a easy to follow linear survey so that Ministry of Health officials could go through concept by concept, consider that in their context, and to provide a judgment based on their experience as to whether that particular pathway or the particular preconditions for those pathways were currently in place within their country or not. And the outcome of that survey then identified the priority areas to be discussed at a workshop. So on the basis of the survey, a workshop was held with Ministry of Health officials to review the outcomes of the survey and to really agree on which particular interventions and indicators would be best to go and further investigate in the work environment based on the whole of the theory of change. So we've got a whole theory of change, we've got a survey to find the strengths and weaknesses, we've taken the weaknesses of the preconditions, and we've then agreed with the team on interventions and indicators to measure that. Then step 3 was to conduct site visits at all levels of the supply chain to identify data sources for the indicators and to capture baseline data. In this context, we used opportunistic sampling because we had a limited budget and did a stratified look from the higher level at the central level down through a region, district, and down to a service delivery point, looking for data for those indicators. Step 4 was to use the data to refine the list of priority outcomes and interventions, remove the preconditions that were met at nearly all the sites, so found evidence to confirm that certain things were in place. Then interventions were selected based on needs, so in other words, reconfirming where the gaps were. Then step 5, conducted focus groups to validate the data to receive feedback on the potential interventions for identified gaps. So step 6 then was confirm the prioritized interventions, and then based on the identified gaps, and then create an M&E plan using the indicators from the detailed paperwork behind the theory of change to support the interventions. So this was the 6-step process that was undertaken. So very quickly, we just mentioned some of the points on each of the pathways. So that motivation pathway includes outcomes on performance, supervision, workers' roles, and their ownership. And the data collection, where interviewed the range of peoples and identified the strengths and areas for intervention. And this is what it looked like from a pictorial example. Where there is a tick, this was identified as being well in place. So this these particular preconditions were noted to be in place. Where there's a star, it indicated that there was particular areas that needed attention or interventions in order to improve that aspect. So supervisors have the skills to communicate feedback on poor performance, supply chain workers understand and care, poor performance is corrected, and supply chain workers have a sense of ownership. They were the 4 areas identified in this pathway for intervention. And again, for each of the 4 pathways, a particular diagram like this was presented and validated at the workshop. For today, we just wanted to highlight quickly the process and give you an overview. So the key learnings of the particular case study was that applying the theory of change through Ministry of Health to apply to a supply chain in Rwanda enabled a comprehensive approach to assess weaknesses and recommending interventions for those weaknesses when you took a holistic look at the human resources pathways. That the theory of change structure allowed stakeholders to have clear visibility into the approach and the process, particularly the summary diagrams and the highlighting of the flow in the more detailed part of the diagrams where there was areas of weakness really helped the government officials to understand the concepts and the interrelated nature of these different aspects of human resources. And one of the key learnings as well was engaging a cross-cutting steering committee with leadership across all relevant departments is key to success. So this was involving HR, planning, as well as the operational departments within the ministry. So again, it's just a high-level overview of a particular case study, which we were quite excited about. We're going through a process of peer review with the ministry of the more detailed report, and we do hope in the next few months to make that report publicly available and published. I'd like to invite you to continue to type questions, and I know that Bridget has been looking at that. I wanted to just note before I hand back to Bridget for these questions that these things we talk about today, the theory of change with their associated graphs and narrative, are available on the People That We've Deliver website. I'll be providing you links to that. Also, I mentioned that the case study will be published in the near future. And the final thing just to note is we are currently working on a rapid tool to rapidly assess those 4 pathways, and that's something to watch out for in the coming months. Bridget, at this point, I'll hand back to you to see what you've noted in terms of the questions that you'd like to address in our final minutes together. Let's make sure that we can unmute you. Bridget, now try again, see if that works for you.
Okay, can you hear me now?
Yes, crystal clear.
Okay, I'm back. All right, what I was saying is, we're at the end of time, but Andrew and I both have a few moments available, and so I'll go ahead and continue to work through some of these questions for those of you who are able to stay on the line and listen. And this is being recorded, so for those of you who have to drop off, you can come back and listen to the rest of this later.
Yeah, and for those of you listening, thank you so much for joining us today. We hope you found it useful. Thanks, Bridget.
Yeah. So the question is, how do we expect supply chain performance improvement without focusing on personal development, learning and development, and supply chain management? That's a great question, and the answer is we don't, and that's why skills is an important piece of this puzzle and one of the 4 pathways that we call out, because you're absolutely right that we can't anticipate without learning, without professional growth, we can't anticipate supply chain performance improvement. So thank you for highlighting that. Moving up, let's see, sorry, in developing countries, setting characterized by lack of good governance, inadequate resources, poor working culture, no standard work procedure, and oops, I just lost. It just went away. No standard work procedure and dynamic environment. How do we implement this theory of change? Please tell us good practices. That's a big one, but ultimately, that is why this is mapped out in such detail, because all of those pieces are things that need to be worked on. Ultimately, though, you need to start somewhere. You need to start with some political will, some commitment, whether internally or externally, of some sort of resource mobilization or reallocation, so that you are going to be able to actually perform some interventions to work on this, and so that's where the advocacy piece of this tool comes in. That's where you can bring this forward and you can show, look, we have to invest in these different pathways and each of these different elements of these pathways if we want to achieve our ultimate outcome of supply chain performance. So if supply chain performance matters to you, here are the things you need to understand about the workforce and what it takes to get them to be able to perform. And you can use that as an advocacy tool to help the decision makers understand why this does need to be prioritized. You can also, as Andrew described in the case study from Rwanda, use it as a tool to really identify where the specific gaps are in this context, so that you take those limited resources and you are really precise in how you apply them, how you focus in on where the specific needs and gaps are. All right, let's scroll up.
If you do have other questions while Bridget's just having a look, feel free to write them. We do have a few more minutes that we can stick around, and we'd be happy to take your questions. No question is too small, so please feel free to ask a point of clarification or a question that's concerning you. Back to you, Bridget.
Yeah. So the next question is, in your experience, would it help to ask employees what motivates them and what are more creative ways to motivate them? Yeah, I think that's a great question. So one of the things is these, what's mapped here are outcomes, but not necessarily the interventions themselves. And it gives, there's room in the indicators annex, there are some ideas of types of interventions you could try, but it's meant to inspire you to figure out where you need to work and then develop the appropriate intervention. And so one way to go about that is this asking employees what motivates them. And there's an interesting piece of work called the discrete choice experiment, which is something that IntraHealth, and that's the organization that Andrew works for, has. They've definitely used it. They may have developed it. And what it does, it was developed for health workers specifically, but can be applied in this context as well. It helps, has the personnel rank on a bunch of different factors, which ones are more motivating to them or less motivating to them, to help understand a package. What packages can you offer employees that are going to be really targeting what they want rather than just assuming you understand what they want and what motivates them? So that's a great observation.
Bridget, Hitesh has put a interesting question for us, and that is, how can donors, what can donors do to influence or shift domestic financing towards HRH for supply chain and HRH in general? And one of the parts of that is in the World Bank in 2017 put out a report to appeal to the finance department within countries that basically demonstrates, was a World Bank report published through WHO, demonstrating a $1 investment in human resources for health in the health system produced a $7 return on investment for that investment. And so I think this requires advocacy. It requires getting in front of officials at the right level for finance, planning, and the ministry to be able to state your case. And we're in a world where money is short and priorities are huge. And so those case presentations, that advocacy requires numbers to demonstrate your case. What's interesting is if you say that you need a doctor to conduct certain medical procedures, people don't really disagree with you at all. That's fine. But if you say you need a logistician or a health personnel with logistic skills to run the supply chain, people sometimes say, oh, that can be done by anyone. And that's not true. You do need the right skills to run the supply chain. So what's the difference between the doctors and the supply chain worker? Well, it's advocacy in terms of understanding the role. There are a couple of thoughts for myself. Bridget, over to you.
Yeah, and so another thing, Hitesh, that can be considered is sometimes it's challenging within a public sector context to allocate funds specifically for staff salaries. However, it may be possible in those contexts to allocate funds to contract for the services. And so maybe it's not a question of making sure that you have hired all of the staff to do those jobs, but maybe there are pieces where if you don't have the resources to hire staff, you can mobilize resources to contract out for the deliverables that you need, for the processes or outcomes that you're looking to achieve. So that's another way of thinking of it as well, that I think can be addressed. And there's another question. Whenever someone asks a question, my screen moves, but let's see. I just had one that I was about to answer. Scrolling back up to find it. Here we go. Oh, it's moving again. Okay. Will you share the presentation with all of us? Yes. We will. And then how do you maintain momentum throughout the change process? I've heard little about communication, ensuring early results through low-hanging fruits, etc. So that's a great question, and I think, again, the theory of change, what it is not a supply chain improvement program. It is a tool that you can use to design that, but you still have to design a program. You still have to develop the specific interventions and activities and map how you're going to move through them, sequence them, prioritize them, all of those pieces. And I think this point really highlights that any such process is a change management process and should be undertaken with some understanding of how you're going to manage that change overall. And those of you who have worked with me know that what really resonates for me is something called the Cotter model of change management, and it's a theory that I think is really accessible in terms of how it breaks down how you should think about managing one of these processes, including the things that are mentioned in this question, including identifying sort of your quick wins, how you ensure communication consistently, and the note on that, I would say, whenever you're going through a change management process, there is no such thing as over-communication, and if you think you are communicating too much, you're still not communicating enough. But it also talks about identifying your champions and how to leverage those as well. So I think that's something, if you're at that point where you're trying to drive some sort of change or transformation in the system, that's a tool that also could be useful. And there's one more question that came through that says, would you attribute the success being recorded from the Rwanda case study to an initial drive or realization by the government of Rwanda? By this, I would like to know if the initial push to intervene in the MOH HR SCM was coming from the donor or the government. If from the government, like in many contexts within low and middle income countries, how do they handle the impact of right-sizing the workforce in HR for SCM that is often characterized by an over-bloated and redundant workforce? Okay, so and Andrew, feel free to jump in on this one as well. Andrew and I actually both just returned from Rwanda over the weekend, doing some related work there. I think that this is a case where it's a partnership between the donor and the government. The government is really motivated. There's quite a bit of change going on in the public health supply chain sector in Rwanda, and that's got a lot of drive from the government. There's I think a fairly solid prioritization of supply chain and recognition of the importance there. And I would not say, and I think that this can be further explored still, but I would not say that there's a redundant workforce in the supply chain system necessarily, although I think that in the Rwanda case, it'll be interesting to see there's actually some restructuring that's underway. So it'll be interesting to see with that restructuring how the workforce looks different. But this is a place where there is the government impetus and motivation to drive change, and so that change is happening as a result, and so some of these pieces that you highlight are being addressed in Rwanda currently. Andrew, did you want to add anything?
Sure. The point I'd like to add is that within the Ministry of Health in Rwanda, at a couple of key levels, the senior technical leadership that oversee the supply chain have had experience in supply chain and understand its importance. And so with that as background, as they've gone through a review process of their supply chain, they are able to advocate for the importance of improving the supply chain, and they are acutely aware of the importance of human resources in that particular context. And with that, they are also a ministry that's very astute to what's happening around them and have latched on to the support that has been offered from the donor community, particularly as it pertains to supporting human resources, restructuring, and interventions to improve systems. Back to you, Bridget.
Yeah, and if you're particularly interested in Rwanda, you can actually probably Google search the Rwandan press in the past couple of weeks, as there have been some articles about the fact that their central medical stores is in the process and moving through approvals in Parliament to become a parastatal entity to address some of these issues.
Sure. So I think we may have nearly come to the end of the questions. Any more there that you've noticed that we may have missed, Bridget?
From my scanning, I think we've answered any of the questions. If there's anyone still online who had a question in the chat box that we missed, please just go ahead and type it again so we can see it. Or if there are any other outstanding questions, I can stay on for another minute or two.
Sure. So just on the screen, I wanted to note that both Bridget and I are very happy to receive any questions via email as a follow-up. We will be sending out the resources. I also wanted to point out that this is the third in a series of webinars that the USAID Global Health Supply Chain Procurement Supply Management Project is offering every 2 months. We offer a webinar, we're recording these, and we do have a YouTube channel set up where these are being collected. So you're welcome to search that out as well. So those of you who are leading at this time, again, we want to thank you so much for your interest and your engagement with us. We hope you found this helpful and are able to apply some of this learning into your workplace. But we still have a couple of moments if you still have further questions you want to type in.
Yeah, and Andrew, do you want to maybe put up the people that deliver email address on the screen as well for folks, or the website? I do also encourage any of you who are looking to apply this theory of change or consider how it's relevant to your context to engage and reach out with people that deliver on it, and also potentially explore the other resources available on their website. So as you can see, it's peoplethatdeliver.org.
And just acknowledging Alexis from People That Deliver has also been typing a couple of things in the chat. Thanks, Alexis. Okay, I think that seems to have reached the happy ending of our webinar today. So Bridget, just a personal thank you from our project for providing your time in preparation and to engage with us in this webinar. It's been a very exciting overview of this particular work that we've been doing together. And I'd like to wish everyone on the call the best as they move forward. And then just another reminder, any particular questions you have, don't hesitate to reach out to us or also to people that deliver. And with that, we will wish you a lovely morning, evening,